Hi guys, quick chat on acne. So I've done a few acne talks, but gosh, it's just such a common problem that I see in many different age groups. So I feel like it's really worth kind of going through it, often. So acne is really, really common, and it can start really very much in the teens age group, and it can be there in the 20s and the 30s. It can be there in the 40s and the 50s. Really, it drops off as the hormone the hormones shift. So really wouldn't see it sort of past 50s. Happens in men and women. And the way I like to describe it in terms of why it happens, or what you need as a formula for acne, you need to have hormones which produce oil, so particular like testosterone type hormones. You need to have a bacteria, P. acnes, which likes an oily environment, so it grows in the oil glands in the skin. And then you need inflammation, which is the redness and the pus. So those three things is what we're targeting with all the different types of treatments when we're trying to treat or manage acne. So we start off often with what I describe as lotions and potions. So lotions and potions are topical things that get put on the skin, and there are over-the-counter things that you can access, and then there are prescription-based treatments. I often, live in the area of prescription-based because, often by the time people come to see me, they've already tried some of the topical agents. But some of the common topical agents might be things such as benzoyl peroxide or salicylic acid. Yeah, they're probably the two main ones. And then we move into the realm of prescription agents, which will be often a combination of things that are like retinoic acids, which is like a vitamin A derivative, and topical antibiotic creams or gels. So they would probably be the main ones. There's also some other groups of things that we sometimes utilize, particularly in pregnant women, say for example like azelaic acid and things. So they're the kind of topical agents. Then when they're failed or they're not adequately working, we then look at other possible agents. So particularly for women, we can utilize some birth control pills which have a sort of anti-testosterone effect. So they reduce oil production in the skin, and they're really effective. So that sometimes will be something that we would add on, and it takes probably, I'd say, 8 weeks before we start to see improvement in the skin. Other agents would be long-term courses of antibiotics, which are essentially to reduce the bacterial load on the skin, but also some antibiotics that are anti-inflammatory. I still utilize those from time to time. They're not my favorite group of treatments, only because, the more we delve into like the gut microbiome and the effects, I always have that sitting in the back of my head. So I really do like to talk to patients about this and kind of go through the pros and cons. And you've got to be on these treatments for quite some time, often 3 months at a time, but they can be very effective and very good for that sort of mild to moderate acne group. After that, there's also some other agents, so some other, I'd call them anti-hormone agents, so things like spironolactone. There's also photodynamic therapy, which can be utilized, as well as some types of lasers, which can also help to settle down, LED lights, those sorts of things, more in the mild groups for the LED. And then for the moderate to severe groups, we then go into the oral retinoic acid, things like the Roaccutane or Accutane type group. And those medications are really just very much drying the skin out. So they're really augmenting that oil production and the cell turnover. Very, very effective. So they are the gold standard, but very strong. Lots of side effects. Need to be monitored. Can't fall pregnant on them. Has been linked with some mood disturbance. So great if you need it, but it's not for everyone, right? So we don't put everyone who's ever had a pimple onto oral isotretinoin, but great for those really severe cases where there's going to be pitting and scarring and things that the other agents are just not as effective. So that's the ladder approach of acne management. If you have concerns, go speak to your doctor.